I wanted to welcome everyone to this next session on increasing access capacity. We've had a very kind of dynamic conversation around a lot of the concepts of access and measurement around access, and now we're going to start to integrate some of those concepts and measures and think about what are we actually trying to achieve as part of improving access capacity. And so we have a very distinguished panel from throughout the U.S., including Dr. Kirsch, who you already know, Dr. Leonie Hayworth, who is the Director of Synchronous Telehealth Services for the Department of Veterans Affairs in the Office of Connected Care. We have Brian Scow, who's with us from Avera eCare, who's the Chief Medical Officer. We have Dr. Tripiani, who's an Associate Medical Director for Access in the Atlantic Kaiser region. And then we have Dr. Lee from Georgia Tech, who will be talking about a lot of the kind of Q theory and other kind of systematic approaches to managing access. So can you advance the slide for me, please, Emily? So I think a lot of these kind of sessions that we were talking about here is really thinking about access capacity, and now we can start to think about how we rethink care delivery itself. And we can think about how we can improve access capacity by addressing issues around access barriers, which include ideas of temporal, as we were talking about timeliness of care, but also for the VA and the Department of Veterans Affairs include broad issues around geospatial access barriers. We have to realize that with the Department of Veterans Affairs is unique in a healthcare system in the U.S. in that we take care of patients across not only the U.S. as a geo landmass, but also includes multiple hemispheres throughout the world. There are also issues around geospatial access barriers when it comes to social determinants of health, such as transportation and the like. And we've touched on a number of these topics over time. But then we'll also start to think about how these health systems have started to think about the goals and measurements of what kind of care they're actually trying to achieve, being able to maintain patient-centeredness, being able to maintain or deliver quality of care services. And then as we kind of alluded to in some of the previous sessions, started to talk a little bit about provider well-being and, and health system engagement. We'll also talk a little bit about how these then start to thinking about other topics that we talked around, including supply and demand management.